LGBT communities are unable to raise children and are discriminated against due to their sexual orientation. With few exceptions, family law is administered at the state level. Currently, there is no federal standard that provides LGBT people with the ability to adopt. There is also no federal standard that prohibits states from discriminating against LGBT people in foster care and adoptive placements.
Adoptions in ancient history mostly involved adult males. Wealthy families who didn't produce boys often adopted older boys or men to provide them with male heirs. As the first settlers arrived to the United States, war, poverty, disease, and other tragedies left many children orphaned. The Children Act, enabled in 1851, it's a law considering the first modern adoption law. During the 20th century, numbers have drastically increased in the United States. In 1851, Massachusetts passed the nation's first adoption law. It required that judges determine if the adoptive parents had consent from the adoptee's guardian or parent, sufficient ability to bring up the child. The number of orphans in the United States spread during the Civil War and its immigration increased in the 19th century. There were many homeless children in the streets, specifically New York. Between 1859 and 1929, about 200,000 children were transported from cities to suburban areas in the Midwest. In the 1960s, the American Psychiatric Association still considered being homosexuality as a mental disorder. New York City had the largest gay population in the United States. Besides the largest crowd of homosexuality, New York was the city with the most aggressive laws. In the mid-1960s, New York created police vice squads to raid gay bars. By 1966, almost 100 men a week were arrested for being gay.
This section is on the Every Child Deserves a Family Act. This is an act aimed at eliminating discrimination against LGBTQ families in adoption. It would do this by preventing taxpayer-funded child welfare agencies from engaging in such discrimination by allowing the Secretary of Health and Human Services to withhold federal funding if evidence indicates that such discrimination is occurring. Who would this act affect? This bill, if passed, would affect foster care children and LGBTQ singles or couples looking to adopt or foster a child, because the Every Child Deserves a Family Act promotes the best interest of the children in the foster care system by increasing their access to the safe and supportive homes of more than 2 million additional lesbian, gay, bisexual, transgender, and queer people who would consider serving as foster or adoptive parents but face barriers due to existing state laws, regulations, and policies preventing them from doing so. This act is necessary because more than 104,000 youth living in the foster care system today are eligible for adoption. However, many taxpayer-funded child welfare agencies still discriminate against qualified, licensed LGBTQ foster and adoptive families, refusing to place youth with these families or forcing them to go through a more extensive, time-consuming, and costly process before allowing placement. Some evidence that supports the Every Child Deserves a Family Act include the idea that 3 million LGBTQ Americans have raised a child and as many as 6 million American children and adults have an LGBTQ parent. Also, 30 years of scientific research overwhelmingly confirms that children raised in LGBTQ headed households have the same advantages and same expectations for health, social, and psychological adjustment and development as children whose parents are heterosexual. Lastly, increasing adoption rates as well as establishing permanency and decreasing risk factors for youth in foster care can help in annual cost savings of between $3 and $6 billion.
Our policy, the Every Child Deserves a Family Act, clearly states the following parameters: that any entity that receives federal assistance or contracts with an entity that receives federal assistance and is involved in adoption or foster care placement may not A. Deny any person the opportunity to become an adoptive or a foster parent on the basis of sexual orientation, gender identity, or marital status of the person or the sexual orientation or gender identity of the child involved. B. Delay or deny the placement of a child for adoption or into foster care on the basis of sexual orientation, gender identity, or marital status of any prospective adoptive foster parent or the sexual orientation, gender identity of the child. or C, require different or additional screenings, processes, or procedures for adoptive or foster placement decisions on the basis of sexual orientation, gender identity, or marital status of the prospective adoptive foster parent, or the sexual orientation or gender of the identity of the child involved. If a state fails to comply with this section, the Secretary of Health and Human Services may withhold the payment of the state of the amounts otherwise payable to the state under Part B or E of Title 9 of the Social Security Act, to the extent that the Secretary of Health and Human Services deems to withhold necessary to induce the state into compliance with this section. In summary, the bill is aimed at withholding federal funds from adoption/placement institutions who are discriminating against LGBT couples or individuals, thus forcing these institutions to no longer discriminate. Although this bill seems necessary in today's world, the expected outcome is not being passed by PredictGov, and the bill may also undermine its own goal. Instead of placing these needy children in good caring homes, it will allow every person or couple seeking adoptive children because no private institutions could turn them away. This would lead to the placement of children in bad homes where they would be much better off in government care.